still inspires me today. Technology, the hand skills and the intellectual need, also the patients in the focus, right? And this is what we are striving for the well-being of our patients. If you see what changed in dentistry world in the last decades, we have so many fields which were in a way automatically digitized. For me, the main aspect of digital dentistry is to gather as many information as possible right at the beginning of the treatment. The other point is, of course, that we have, I call it the island solutions. That means we have digital X-ray, we have the intraoral scan, we have the CAD software, the 3D printing, the milling, the facial diagnostics. We are building bridges from island to island, and we continuously connect those islands to a full workflow. This will help us to get out the most of the relevant aspects of a treatment of a patient's case. Digital dentistry has the potential to objectify our profession. We are the bad guys. We say you didn't brush your teeth, you have a caries, we need to do a filling or restoration. Maybe in future we could say, well, our scanner says, okay, over the last 3 years you develop here a growing decay. I can help you. Maybe there's an objectification for our patients and a better understanding for their dental health. Another aspect is the functional aspects from the TMJ and the mandible movements. Let's assume we have a perfect intraoral scan of upper and lower jaw, and we need a centric relation. I have an interface which is connected to my upper and lower jaw. But how do I position that in my digital articulator? There is not a real constant workflow at the moment, which I would say is ready for daily office and daily use. One workaround is not the digital articulator, but what I call the virtual articulator. That is where I really cover the movements and I create the interfaces. And this brings me even closer to the patient's real movements. There are still analog gaps in our workflows, and we need to carefully consider where do we do a step back even when we work digitally. It's not a digital world and an analog world. Digital and analog forms a dialogue. The main aspect and the decision is what can bring me to this demands the easiest and the most reliable way. What we will see in future is technologies that give us the possibility to come closer to the nature. If we take the technology from caries diagnostics, for example, we maybe can filter out the inner surface of the dentin core, and we can distinguish inner surface, outer enamel surface, and then we have 3D printing technologies that can directly imitate that. We have the technologies to provide us much more information, but we also have to learn how to use this technology for the sake of our patients. The FDI World Dental Congress, I think, is the place to be this year. To interact on a neutral and very positive way is very important at these special times, and I'm looking forward to see you there and to interact with you. And learning from each other is one key element in this very challenging but also interesting professional times in dentistry.